let's go over some of those programs because, you know, most of us have, I have no clue. I'm sure a lot of people have no clue. Talk about your mental health and what programs you have for that.
Okay, the mental health, we have regular outpatient services that offers counseling, psychiatry services, as well as case management services. So there's a lot of different things involved in that, which can be really helpful for individuals with mental health. But that outpatient services program also works with individuals who have substance use issues, and also the dual diagnosis. So someone who may be dealing with a substance use problem and a mental health problem.
So can they get medication too for bipolar and all that?
Yep, they can do medications and everything, which is awesome.
That is awesome. And then how about if I'm coming into you and I'm a heroin addict and I know I'm gonna, you know, be sick. Do you take people in like that, or?
Yeah, at the crisis center on 13th Street, we do have a detox program there. So it is strictly detox, but it is inpatient. So they do stay at the crisis center, just right upstairs. If someone were to come in, we would need to get some information from them, kind of figure out what they're using, how much they're using. We are limited to serving people that live in Stark County because we are funded by the Mental Health and Recovery Services Board of Stark County, as well as United Way and then other outside funders. So since our funding is so limited, we can only serve people that are in Stark County.
Right, that makes sense. So how long can they stay? How many beds do you have? Let's get some details going, because that's the questions everybody asks me.
We have 9 beds on our detox unit, and individuals, depending on what substance that they need assistance with, if it's alcohol, it's usually about 3 days. For opiates or benzodiazepines like Xanax, Ativan, something like that, it would be 5 to 7 days typically. So it is short term, but it still can help people get through that initial period of withdrawal when people are feeling really sick, and a lot of times that's why people continue to use, is because they don't want to feel sick.
They don't. Well, you know, I battle with that thought of, you know, just once you get over it. And how long does it take to get over the heroin sickness? The dope sick, as they call it, do you know?
We kind of look at it as like a bell curve. So if you kind of look at it, it usually peaks at like 72 hours, and then it usually starts to get better. Some people, it may take a couple weeks to start feeling 100% better, but a lot of people, after they get through the initial 5 days, they're really starting to feel a lot better, most people. So everyone is kind of different. Everyone's body chemistry is different, and how, you know, how they're affected by the drug.
And do you see a lot coming in there? Tell us about your experiences and what you see.
From my experience, I've been working at the crisis center for about 3 years, and we've seen a bigger increase in people with heroin or opiate dependency. So the people that are using alcohol, it seems like that's kind of declined a little bit, just because the heroin problem in Stark County is so bad.
It's an epidemic. It really
definitely. But I mean, we've seen a lot of people from all ages. We do only serve people that are 18 and above, but we've seen people that are 18 all the way up into their, 60s.
So do you mix men and women?
For the unit upstairs, we do have men and women, but they do share a room with one other person of the same sex.
Okay. And after they're done with their stay, then what?
We have a couple programs set up where we have people from Quest Recovery Services as well as TASK that come into the crisis center while they're there a couple times a week, and can set up follow-up appointments and kind of help create the linkage to other treatment centers like Quest with outpatient treatment there, same thing with TASK. So that's been really helpful, and we can kind of help get people the resources that they need to continue with treatment and hopefully be more successful in that way.
Do you have to turn people away?
Unfortunately, sometimes we do, and that's really difficult because we don't want to do that, but there are some people that if they don't live in Stark County, that's probably what we get the most of, is people from other areas that aren't fortunate enough to have a detox program, that they come to us and we unfortunately can't serve them, which that's really difficult. And some people, are looking for something more long-term, a 30, 60, 90-day program, which unfortunately in Stark County, we do have residential programs, but not actual rehab centers that are like that.
Right. Well, I think we need a a little bit more of rehabs and more. So tell us about the adolescents, because I didn't know anything about that.
I'm not really all that familiar with that just because I don't work at that building.
Okay.
But the multi-systemic therapy is a lot of children and adolescents who may be like referred by the court or other treatment providers. It's a very family-based type of treatment where the family's involved, school, obviously the child, and then it's the court sometimes, depending on what's going on with the child. It just kind of pulls everything together. They have it's very team focused, so everyone's kind of on the same page with the person and everything else. At the crisis center, we can see children, but we can't admit them. So that's probably the biggest thing. So if there is ever a child in crisis or an adolescent in crisis that may be having suicidal thoughts or something like that, we can still see them and try to figure out the best recommendations for them to get the treatment that they need.
So if someone comes in your front door, an adult, and they say, I just thought about killing myself, I'm just on the verge of that, and I'm doing heroin, you'll take them in. I mean, let's forget the heroin. They just tried to kill themselves. That you take those.
Yep, we have, in addition to our detox unit, we do have our crisis stabilization unit, which is also upstairs. We have 10 beds there, so we can admit people, once again, 18 and above, that may have had a suicide attempt, even just thinking about suicide, even if they're not suicidal, but they're dealing with depression or just something that they need some extra help at this time, where, you know, their regular counseling may not be helping them at the moment. They just need kind of a little extra. That's something that we can admit people for too.
And you have counselors that are on hand. Are they 24/7? What are the hours?
We have counselors available 24 hours a day, 7 days a week. We do admissions 24 hours a day, 7 days a week. Typically our detox unit, we don't do them 24 hours. We schedule appointments for those typically. So.
Really? So how do you schedule an appointment for someone that's going to come in and they want to detox from heroin? I mean, because by the time they come back to you, they may not come back.
Right. A lot of people for our detox unit do call us, and we do have a waiting list sometimes right now. It's very short, so we are getting people in within about a day, 2 at the max. Sometimes it can be a little bit longer than that, but we're still getting them in a lot quicker than some of the other places outside of our area. I know some other counties have week waiting lists, and
that's insane, because they're definitely either just not going to come back, or they're dead from their overdose, you know, which is very typical. Let's go out and use one last time, and they don't make it because it is their one last time.
And that's very unfortunate, and you know, that's why we were trying to keep our waiting list down as short as possible. Previous to that, I mean, it was just call, and if we have a bed, then come in, and then, I mean, there were people that were calling maybe every half hour, and then they may have just missed a bed because someone called 5 seconds before. So the waiting list has kind of been helpful to make sure that we're, you know, getting people in and everyone's getting the help that they want. And, you know, if anyone's interested in coming in for detox, we just ask that you give us a call or even stop in, and we can get you put on our waiting list if we don't have a bed available at that time.
And we will give the phone number at the end of the show so that people can take this down, and if you have a family loved one that needs help, or you yourself needs help, you know, please give them a call, because they will help you. Let's talk a little bit about the Dawn Project.
Okay. Project Dawn is a contract that we were able to get from the Ohio Department of Health. Amanda Archer from the coroner's office was very instrumental in helping the Mental Health and Recovery Services Board obtain that contract, so we were able to give out Narcan kits. So Project Dawn actually stands for Deaths Avoided with Naloxone. Naloxone and Narcan are the same thing. One of them's the name brand, and one of them's the actual name of the medication.
And what is that medication?
It's a medication that will reverse an opiate overdose. So heroin, pain pills like Vicodin, Percocet, oxycodone, morphine, fentanyl, any number of those things. But it's a medication that will basically take the opiates off of someone's brain and allow them to start breathing again.
Okay. Okay, that is interesting because where can you get that? That's life saving. That's amazing.
We're actually fortunate, the Crisis Center on 13th Street, we're actually fortunate enough to be one of the sites that are able to give out the kits for free to individuals. We do that on Mondays from 11 to 2 p.m., 11 a.m. to 2 p.m. And Quest Recovery Services, they also do it, I believe, Mondays and Wednesdays. They pass out kits.
Now, what's a kit? What's inside this kit?
A kit, it's a bag, so everything's nice and neat, handy. It comes with a DVD, which you do watch when you come in for the education and the training to get a kit. It comes with a reference guide, so you can kind of flip through if you were to need to use the kit and someone's not familiar with how to do it. It comes with a CPR face shield in case you would have to come across someone that you may not know and don't feel comfortable giving them direct CPR. So that's kind of a nice feature that we have. And then it also comes with the actual medication, and it comes with atomizers that make it a nasal spray. So it's not an intravenous or intermuscular thing like an EpiPen would be. So it's very easy for anyone to use, and there's not a risk of putting it in the wrong place or anything like that because it is in your nose.
That's interesting. I did not know that.
Yeah, it's very, very nice. So when you come in for the training, you watch, we do a registration form just to get some information about usage and everything else. And then you watch the DVD. And a DVD takes about 15 minutes to watch, even though you were sending you with one. We just want to make sure if you have any questions, we can answer those. And then you meet with our doctor who actually writes a prescription. And it doesn't have to be someone who's addicted that comes in, and a family member can come in. There was a law that was recently passed that allows us to give it to any family members, friends, or even people, even if they're not addicted, but they're prescribed a pain medication for whatever the reason may be, but may have some other health symptoms, like if they have a respiratory problem or something, that can also put someone at a higher risk of overdose. And we can also give kits to those individuals too.
Now, if I wanted a kit, you know, I don't know anybody. Well, I do. She's in jail, thank God.
Okay.
But I don't have anybody in my immediate surrounding that has any kind of a addiction problem. But I do have a lot of people that I counsel, you know, and that they could go back. Can I have a kit? Can I go there and do I have to know anybody? I don't know anybody at the moment. I could still get one?
You still could. I mean, we usually try to get people that are living with someone or who's at a higher risk, which the person that you said was in jail. Being in jail or treatment, coming out of that can put someone at a higher risk of overdose because they're considered opiate naive. And their body's basically has no opiates in it. So coming out of treatment or coming out of jail where they're not using can put them at a much higher risk. So.
Well, I definitely want one on hand because I do run across people. They do call me for their children or, you know, whatever the case may be. And I think that's, you know, do you have a shortage on them by any chance? I mean, if I just, like, all these people start coming in and we have, thanks, Michelle.
No, right now we still have quite a few kits left, and we're working with the Mental Health and Recovery Services Board to be able to obtain additional funding when we do run out of the kits. But right now we have, I don't even know how many we have left, but we have quite a few.
Okay, well, it's time for a break. And when we come back, we'll continue talking about the Crisis Center and the Dawn Project with Allison. If you would have a question for Allison, please do give us a call at 330-492-6881. We will be back after these messages. Welcome back to Addiction Voices of Hope, heard here on WNPQ 95.9 The Light. When we left, we were talking to Allison Rolfe from the Crisis Center. And Allison, I know that I don't even begin to have the knowledge of what else the center does. So just load us in right now. Tell us everything, because I just heard something. You have this domestic violence program?
Right. We do have, it's called Free Space. It's a program for women who have been victims of domestic violence or perpetrators of domestic violence. It can be court ordered, but we have that program. We also have a community education and prevention program at the Crisis Center, which that person, they do a lot of training with police officers, teachers, other community members.
What kind of training?
Suicide prevention, looking at signs of suicide, depression, what we do at the Crisis Center, I know she's getting ready to do CIT training, which is a crisis intervention training for police officers, dispatchers, and members of like first response teams in the community.
Okay, so you're also training the law enforcement on certain things on what to look for as well.
Right, and how to handle people with mental illness, because sometimes, you know, if you're not familiar with people with mental illness and you're, you know, going up to someone, what you may say to someone else may not work for someone who's mentally ill.
That's right. So if I just came to you, I'm all beat up, my boyfriend just beat me up, what would you do for me? What can I look forward to, I guess, if there's anything to look forward to?
If you were to come into the crisis center in that situation and you're a victim of domestic violence, we do also do screenings for the domestic violence project. So we would just have you get in contact with them, come into our facility, we can have you call them from us, from our facility, so you're in a safe environment.
I'm just going to say, is this a safe environment?
Yes, it is. We are open 24 hours a day, like I said before, 7 days a week. We don't have security on hand, but it is a, you know, locked facility where there's something maybe in danger. You know, if you're trying to escape a domestic violence situation, you know, we have a good relationship with the police officers in the area, and you know, they're there quick if we need them. You know, if someone's following you or something like that.
That's another thing with domestic violence, is a lot of that is alcohol and drug related. Are you seeing that somebody will come in and say, well, you know, he was drunk and he was, or she, whatever?
It kind of depends. I don't personally do the screenings for the domestic violence project when they're coming in, so I can't really say for sure, but I know that a lot of that can happen. I know there's people that, you know, that's one of the reasons that they say, oh, it's just because he was drunk, or whatever the situation may be. But we get, you know, people from all across that may need help, and, you know, we try to help them the best way that we can.
So if I wanted to come in and get some additional training, what kind of training? Like, I want training on everything. You know, I got to know it all. So do you just offer training to just the average person, and is there a cost to it?
I don't believe we have a training specific for just anyone who wants to come in. I mean, we can definitely give you information, you know, whatever you're looking for, which I know is everything. But we have a lot of information, I mean, as far as what programs we offer, different resources in the community. We do have our crisis hotline, which is manned 24 hours a day, 7 days a week by our crisis counselors, and we do also have some volunteers and triage specialists, which is what my position is there. And we're all very familiar with a lot of the resources in the area. So it's not something that we offer at our facility. Like if they're looking for a domestic violence shelter, we don't do that, but we can provide you with referrals for that, as well as other treatment places in the community, or if you're looking for a residential facility for substance abuse like Quest offers, we can, you know, give you their phone numbers and stuff like that too, which is really helpful that we have people that are so knowledgeable with resources in the area.
So what else do you do there? Because obviously there's a long list.
Yes, there's a lot. I know we kind of talked about we talked a lot about our detox program and our stabilization unit. You know, anyone who's in a crisis and just needs to talk to someone, even if they don't want to be admitted to our facility or anything like that, but just need someone to talk to, and it's Friday at 11 p.m., you know, and you can't wait until Monday morning, or, you know, we can see you. You know, if you just come in, we have our counselors there that can see people anytime and, you know, offer that crisis counseling to help get them work through the problem that they may be facing and help them in whatever way we can.
So if I'm in crisis, doesn't matter what crisis, and I call the number, will you talk to me on the phone and just talk me out of whatever crisis that I'm in?
Yeah, all of our crisis counselors, we do the crisis counseling over the phone. So if you're having whatever, maybe a breakup or a problem with a friend and not sure what to do, not sure where to turn, you can call us and we can help try to direct you and try to work with you to find out what's going to be helpful for you in finding solutions.
That's awesome. Okay, let's keep going, because there's a lot to talk about with the Crisis Center.
And then, I'm trying to make sure I cover everything.
We don't want your boss to be upset. We want to make him proud.
Yes. One of the other things that we do is we are a pre-hospital screening agency for admissions to the state hospital. So if there's someone who may be very resistant to getting treatment for mental health, who may not be willing to, but may be at risk of harming themselves or someone people in the community at some of the local hospitals if they need assistance with getting someone help, and that may not, there's a lot of different factors that go into that, but we can also assist with them and making sure that they get the help that they need if the hospital or someone else in the community is not able to help.
What's the state hospital?
It's Heartland Behavioral Health. It's in Massillon.
Okay.
It's the old state hospital, the
Okay.
Massillon State Hospital.
I've heard.
Um,
Okay.
But we can help facilitate the screening process for that and getting people admitted if they may not have another place to go, if they may be violent or whatever the situation may be. So there's a lot, like I said, there's a lot of different factors that can go into that, but that's, we always try to avoid, placing someone there if they don't need to.
Right.
So, we'll look at our unit, other hospitals in the area, as far as getting them help.
Do you have this Suboxone program too?
Unfortunately, we don't. I know Quest Recovery Services, they do have the Suboxone and Methadone program, but unfortunately for our facility, we don't offer that. But our detox, we do give medication to help deal with the withdrawal symptoms.
Like what?
It depends. Typically, it's a mixture of, it's like 3 or 4 different medications. Clonidine, Ultram, and phenobarbital, I think, is what they typically use. But that can always change based on what the doctor.
What are those? What do they do?
It can help. I'm not a
Okay,
I'm not a physician or a medical professional, so I can't say exactly what they do, but
Right.
it can help ease some of the sickness that people are feeling, some of the hot, cold sweats,
Okay.
the nausea, vomiting, just any typical withdrawal symptom that someone may be experiencing.
Oh, okay, because I had no clue either.
Yeah.
But
And we do have, on our detox unit, we have the nurses that are there 24 hours a day, 7 days a week. We have technicians that are there, and if someone is on our detox unit, they see a doctor every day. So they kind of monitor medically to make sure that, someone who's using alcohol isn't at risk of seizures or, anything else, because that can be very dangerous to detox at home.
and what else would you like to say about the Dawn Project? I'm hearing some controversy or people saying support it. Is it up on a bill or something like that? I mean, do we have to vote on something? What is the deal here?
No, it's been a lot of just making sure that we can get it to people in the community, because it is a medication. And having prescriptions basically for anybody, that was kind of what the controversy was. A lot of people have had thoughts that it's going to enable people to continue to use because, okay, well, this is their safety net. And that's not the case. It's very much a harm reduction program. So if we can save a life, that's what it's for. And most people, I mean, when we do the Project On and we're talking to individuals who may be addicted, and they say, I don't want to go into withdrawal, but I'd rather live than I'd rather
Right.
live.
Right.
And if withdrawal is a side effect of that, I'd rather live. And that's the biggest thing, is that people aren't going to use as much as they can, overdose, and then go into withdrawal right away.
I do just want to put this out there. If you are a heroin addict and you're worried about withdrawals, it's a short period of your life. And it lasts, what did you say, 7 days at the most for the worst part of it? That's only 7 days. That's 7 more days you're going to live. And your recovery, to not have to go and work so hard at getting your drug, because it is hard work, you could start to feel better and you don't have to worry about that again. I mean, when they come in to do detox, are they getting some counseling? That's awesome.
Yeah. Anytime that someone comes in for a detox, they always meet with a counselor first just to kind of get some information and do the intake and everything else. But they do have groups that they offer on the unit, and they have like AA meetings that are set up for people that are there, so that way they can also get that type of treatment too.
And let's put everybody else's mind at ease. When someone comes in and they're on heroin, you're not going to call the cops on them, right?
Right.
Okay.
No, we do not do that. We do not call the cops. We do not, it's confidential, like any other treatment would be. We don't give any information out unless you tell us to.
Okay, well, we have to go to break, and when we come back, we'll close up with Allison in the Crisis Center. If you have we're closing. Boy, this went so fast. didn't even realize we're over. Well, I will see you tomorrow. Thanks for listening to Addiction Voices of Hope here on WMPQ 95.9 The Light. I'm just so interested in this that I don't even want this show to end. I think I'm going to continue talking to Allison when we leave. If you have any questions for me, just go to my website and you can email me at michelle@addictionvoicesofhope.com. Have a great day until tomorrow. Love yourself.